We previously talked about Mr. Henry, who got improvement in his condition after taking allopurinol. Apart from that, there are some patients who experience some side effects after taking allopurinol, like hypersensitivity. It's the most common side effect. Hypersensitivity is the major side effect of allopurinol. Let's learn how this reaction is triggered and cause itching, fever, and pruritus. This risk is increased in those with reduced renal function. It is due to the presence of HLA-B allele. HLA-B is actually a major histocompatibility complex class B that provides instruction for making a protein that plays a critical role in the immune system. Presence of HLA-B allele and high concentration of oxypurinol function synergistically to increase the number of potentially immunogenic peptide oxypurinol HLA-B complexes on the cell surface, thereby increasing the risk of T cell sensitization and a subsequent adverse effects like skin rash and pruritus are observed. A part of hypersensitivity reaction, other side effect includes GI upset, vomiting, diarrhea, toxic epidermal necrolysis, and Stevens-Johnson syndrome. Because of gastric upset, diarrhea, and nausea, it is preferred to take allopurinol after meal. Also, its side effects can be minimized by using it into divided doses. Allopurinol can cause Stevens-Johnson syndrome. Stevens-Johnson syndrome is a rare but serious disorder that affects the skin, mucous membrane, genitals, and eyes. The mucous membrane is the soft layer of tissue that lines the digestive system from the mouth to the anus, as well as genital tract, reproductive organs, and eyeballs. Whereas toxic epidermal necrolysis is a life-threatening skin disorder characterized by a blistering and peeling of the skin. Here we learned about the major side effects of allopurinol that one can experience. To learn more about the interaction of allopurinol with different drugs, keep watching sqadia.com.